CIET NCERT presents the audiobook of Physical Education and Well-being titled Khel Praveen for Grade 9.
Page number 29. Unit 2. Science and Sports. A QR code has been given at the top right corner of this page. You may scan the QR code for more information about this unit. This unit delves into the scientific understanding of the human body and its systems, emphasizing their role in physical activity and sports. It explores anatomy, physiology, and movement science, helping students understand how the body functions during movement. The unit highlights the importance of maintaining a healthy body through proper care of bones, muscles, joints, and the cardiovascular and respiratory systems. It also introduces concepts like cellular respiration, the structure and function of the heart, and the circulatory system, emphasizing their role in physical performance. The unit explains the classification of joints, muscles, and their movements, providing insights into how the body generates force, strength, and power. It also discusses the types of levers in the body and their role in movement. Students are encouraged to observe and analyze their own physical activities, such as kicking or throwing a ball, to identify the muscles and joints involved. This hands-on approach helps students connect theoretical knowledge with practical applications. Additionally, the unit highlights the effects of exercise on the body, comparing short-term and long-term changes in various systems. It emphasizes the importance of warm-up and cool-down exercises, proper breathing techniques, and understanding the body's adaptation to physical activity. Through engaging activities and exercises, students learn how to optimize their physical performance and maintain holistic well-being. At the left bottom corner of this page, a figure has been given of a female athlete, which illustrates her playing a game of badminton with a badminton racket and a shuttlecock. Page number 30. Chapter 5. Understanding our body. In the previous unit, we learned a couplet from the epic Kumarasambhavam, describing that all the duties in life, or all the actions and skills in sports, are only performed through our body. Therefore, it is necessary to understand the structures, systems, and mechanisms of our body, which include the bones, the muscles, and various other systems. While performing physical activities on the ground, we witnessed some extra tension in the muscles, panting, relaxing, heating, etc. Why do these and other similar changes occur in the body? We will study this in the present unit. India stands out for developing one of the oldest medical systems in the world through Vedic philosophy and the Ayurvedic tradition. One of the greatest figures in this field was Maharshi Sushruta, who is remembered as the father of surgery. Maharshi Sushruta lived and learned with his teacher, observing and practicing medicine in real-life situations. His studies were deeply rooted in Ayurveda, known as the science of life. From a young age, Maharshi Sushruta was also trained in herbal medicine, gaining both theoretical and practical knowledge. Maharshi Sushruta's contribution laid the foundation for modern medicine and surgery. His teachings spread to China, Arabic, Persian, and European countries, influencing later physicians and scientists. Many of his techniques, such as rhinoplasty, that is, nose reconstruction, are still used in modified forms today. His life and work remind us that science and compassion must go hand in hand. On this page, a figure has been given in which Maharshi Sushruta has been drawn treating a patient through traditional means. Page number 31. Activity. Straighten up your legs and grip your thighs to feel the muscles while sitting on the bench in the classroom. Identify which movement is related with squeezing and releasing the tension of the muscles of your thighs. The scientific study of the structure of the human body is known as human anatomy. It is about understanding what our body parts are and where they are located. Physiology, on the other hand, is the study of how different organs and systems of the human body function to maintain life, while anatomy shows us what and where. Physiology explains the how and why of bodily functions. Activity. Perform controlled movements such as wrist rotation, knee bends, toe raise, and arm swing. For each movement, identify the joint being used, shoulder, knee, ankle, or neck, and describe the type of movement it allows. Then, perform gentle dynamic stretches and observe how the joint moves more easily after warming up. This activity helps students understand how joints allow movement and why proper warm up is important for joint safety and performance. Here, figure 5.1 is given on page number 31. In this figure, four illustrations are given, wherein wrist rotation, knee bends, toe raise, and arm swing activities are drawn. Bone. Bone is a strong and rigid type of connective tissue that makes up most of skeleton and gives the body its structure. The types of bones are shown in figure 5.2. It is active and always repairing and rebuilding itself. If a bone is injured, it can usually heal and function normally again, depending on the severity of the injury. Page number 32. Activity. Let us play a game. Make a group of 5 members and prepare 5 chits with one bone type written on each chit. Each member will pick a chit and indicate the location of the mentioned bone on their body. Here, figure 5.2 has been given. In this figure, a skeletal system of a human being has been drawn, with various descriptions of different types of bones. The first description shows the flat bones. These are flat and thin, possibly curved, protect internal organs, for example, cranial bones, scapula, some facial bones. The next set of bones described are long bones. These are tubular in shape, long axis, 2 ends that articulate with other bones. For example, humerus, femur. The next set of bones are irregular bones. Complex shapes, for example, vertebrae. The next set of bones given are short bones, cuboidal in shape, for example, carpal bones. The last set of bones given are sesamoid bones, unique, lie within tendons, for example, patella, scaphoid. Cartilage. A cartilage is a tough yet flexible connective tissue that helps protect bones and joints by absorbing shock. They are indicated in figure 5.3. The cartilage found at the end of bones minimizes friction and keeps them from grinding against each other during movement. In some areas of the body, cartilage also serves as the primary tissue, giving those structures form and shape. Cartilage damage can occur suddenly from injuries such as sports injuries or trauma, but it can also develop gradually over time, that is, through overuse injuries. Figure 5.3 has been given at the bottom right corner of page number 32. Here in this image, cartilage tissues are indicated in the bones of legs and ears. Page number 33. Activity 1. Why do you think the calf muscle's tendon, which is inserted into the calcaneus, is called Achilles tendon? After your teacher narrates the story behind this name, discuss the values you learned from it and identify a similar story from the Indian epic Mahabharata. 2. With the pinch grip, try to hold and feel the texture of your Achilles tendon below the calf muscle and above the heel bone, as shown in figure 5.1. Is it similar to what you feel when you touch your ear? Discuss the similarities and differences with your peers. Figure 5.4 has been given here. It illustrates a hand holding and feeling the texture of an Achilles tendon right below the calf muscle and above the heel bone. Tendon. A tendon is a tough, flexible band of tissue that attaches muscles to bones, allowing your limbs to move. It also helps protect muscles from injury by absorbing part of the impact that occurs during activities such as running, jumping, landing, or other movements. Figure 5.5 has been illustrated here, wherein a part of the foot has been drawn. It shows the tendon. It highlights various parts of the leg and the feet, like the gastrocnemius muscle or the calf, the Achilles tendon, the metatarsal bones, and the calcaneus or the heel bone. Did you know the total amount of movement that occurs in a joint in a particular direction is known as range of motion? Ligaments. Ligaments are strong, fibrous bands of connective tissue that link bones to one another and help stabilize key structures in the body, including joints and certain organs. They connect bones to maintain the integrity of the skeleton, secure the ends of bones within a joint, guiding and limiting their movement, strengthening the joints, and reducing the risk of injuries. Here, figure 5.6 has been drawn. This illustrates a ligament. A ligament is a strong fibrous bands of connective tissue that link bones to one another. Here, a figure is given which points out cartilage, ligament, and tendon. Page number 34. At the beginning of the chapter, we had activities involving various movements that use different joints. Let's recall those movements and try to understand the different types of joints. Joint. A joint, also called an articulation, is a location where two or more bones meet to form a connection that allows movement. Joints in the human body function as hinges, pivots, and sliding mechanisms, providing mobility and enabling human locomotion. Joints also provide structural support and stability to the skeletal system. They are classified on the basis of structure and function. Classification of joints. Structural classification. Fibrous joint is a type of joint in the body in which bones are connected by a dense fibrous connective tissue, like collagen, which provides strength and stability. For example, skull, with no direct movement, head protection in contact sports like boxing. Here, figure 5.7 has been given. In this figure, a picture of a human skull has been given. This has fibrous joints or immovable joints. Cartilaginous joints are a type of joint where bones are connected by cartilage, allowing for some movement but less than that in synovial joints, for example, vertebrae. It provides pelvic stability during sprinting. Figure 5.8 has been given here. This figure has a picture of cartilaginous joints or semi-movable joints. Synovial joints are freely movable joints characterized by a fluid-filled cavity covered by a membrane known as the synovial membrane between articulating bones, for example, knee, shoulder, etc. It helps in wrist gliding in gymnastics. Here, figure 5.9 has been given. This has a picture of a synovial joint, that is, a freely movable joint. Page number 35. Functional classification. Immovable joints are a type of joint that allow for no movement under normal conditions. These joints are characterized by the close proximity of the articulating bones, which are held together by fibrous connective tissue or cartilage with no joint cavity. For example, skull. Figure 5.10 has been given on this page, in which there is a picture given of a skull suture, that is, an immovable joint. Slightly movable joints are a type of joint that allow for a limited range of motion. These joints are characterized by bones connected by cartilage or fibrous connective tissue, enabling some degree of movement while maintaining stability. For example, vertebrae or spine, etc. Figure 5.11 has been given here, wherein a picture of the pubic symphysis or a slightly movable joint has been given. Freely movable joints are a type of joint in the human body characterized by a joint cavity containing synovial fluid, which allows for a wide range of motion. These joints are crucial for enabling activities like walking, running, and grasping. They are mostly found in the limbs, facilitating various movements, for example, shoulder, hip, knee, elbow, wrist, etc. Figure 5.12 has been given here, in which there is a picture drawn of two freely movable joints, wherein there is a synovial containing synovial fluid which allows for a wide range of motion. Activity. Types of liver joints. In your physics class, you have read about three types of livers: first class, second class, and third class livers. Recall the concept and discuss whether these types of liver are present in our body. Page number 36. Synovial joints are further classified into the following types. A. Ball and socket joints. They allow movements in all directions, for example, hip, shoulder, etc. B. Hinge joints. They allow movements of flexion and extension only, for example, knee, elbow, etc. Figure 5.13 has been given on this page, which shows the various types of synovial joints. At the center of this image, a female athlete has been drawn while she is playing badminton with the help of a badminton racket and a shuttlecock. Various parts or joints of her bodies are pinpointed and named as different kinds of joints. Her neck shows a pivot joint between C1 and C2 vertebrae. The next is the hip joint, where the ball and socket joint have been given. C is the gliding joint between the tarsal bones at her feet. D is the condyloid joint between radius and carpal bones of the wrist. E is the saddle joint between trapezium carpal bone and first metacarpal bone in her fingers. Point F shows the elbow as a hinge joint. Page number 37. C. Pivot joints. They allow rotational movement. For example, atlantoaxial joint in neck, radio-ulnar joint in forearm, etc. D. Gliding joints. They allow sliding movements, for example, wrist, ankle, etc. E. Saddle joints. They allow movement in two planes, for example, thumb, etc. F. Condyloid joints. They allow movements in all directions but not rotation. For example, knuckles, etc. Muscles. Muscles are tissues in the body that produce movement, maintain posture, and circulate blood by contracting and shortening. The structure of the muscles is shown in figure 5.14. Here, figure 5.14 has been given, wherein the structure of muscles has been drawn. Various parts of the muscles have been pinpointed, which are the bone connected with the tendon, the muscle bundle containing the blood vessel, the muscle fiber, and the endomysium. Classification of muscles. There are three main types of muscles: skeletal, voluntary movement, smooth, involuntary movement, involuntary functions like digestion, and cardiac, heart function. Page number 38. Activity. Study the image and try to identify and feel the muscles and joints while jumping. Figure 5.15 has been given here, in which functional classification of muscles, bones, and joints are given. Here, there is a diagram given of a male athlete who is bending and trying to jump. Various classifications show muscles, bones, and joints. Muscles have been shown in red, joints have been shown in blue, and bones have been shown in black. The given muscles are trapezius at the shoulders, pectoralis major at the chest, deltoids, triceps, and biceps in the arm and forearm, rectus abdominis at the abdominal, quadriceps group in the thighs, gluteus medius in the hip muscles, gluteus maximus at the back of the thighs, hamstring group in the hamstring muscles, gastrocnemius at the calf muscles, soleus in the leg muscles. Now, the given joints are shoulder joint, knee joint, and ankle joint. The bones that have been marked in the male athlete's body are clavicle at the chest and the shoulder area, humerus in the elbow area, pelvis at the pelvic area, patella and tibia in the knee and leg area, and femur in the knee area. Page number 39. Skeletal muscles. These types of muscles are attached to bones. They allow movement and maintain body posture. They are long, cylindrical, multinucleated, and striated in shape. Since they consciously control body parts' movement, they are also called voluntary muscles. For example, biceps, quadriceps, deltoids, etc. Let us recall. There are 206 bones in the human body, but it is not only the bones which ensure our body movement. Recall plank and other exercises from the previous classes and how nearly 639 muscles in the human body help in performing various actions. Try to jump, hop, and leap for a few minutes. Then, when you stretch, the sensation in your limbs is actually originating in the muscles. Can you help your parents and peers learn the names and know the locations of some muscles? Smooth muscles. This type of muscles are found in the walls of hollow internal organs of the human body, like the stomach, blood vessels, intestines, etc. They are spindle-shaped, single nucleus, and non-striated. They are primarily controlled by the autonomic nervous system ANS and regulate involuntary functions such as iris of the eye, heart rate, digestion, and blood pressure of the human body. Figure 5.16 has been given here, which has a classification of muscles. Three different kinds of muscles have been given here. These are smooth muscles, the insides of stomach and intestines, skeletal muscles, which is the insides of regular muscles, and cardiac muscle, which are the insides of heart muscles. Page number 40. Did you know how are different skeletal muscles in the body named? In the previous grades, we've read about different muscles. Let us recall and associate them with the following: shape, deltoid, triangular; quadratus, square; rhomboid, diamond shaped; teres, round; gracilis, slender; rectus, straight; and lumbrical, worm like. Size: major, minor, longus or long; brevis or short; latissimus or broadest; and longissimus, longest. Number of heads or bellies: biceps, 2 heads; triceps, 3 heads; quadriceps, 4 heads; and digastric, 2 bellies. Depth: superficialis or superficial; profundus or deep; externus or externi, that is external; and internus or interni, that is internal. Attachment: sternocleidomastoid, from one bone to another bone, that is from sternum and clavicle to mastoid. Position: anterior, posterior; medial, lateral; superior, inferior; supra-interosseous; infra-interosseous, that is between bones; dorsi, of the back; abdominis, of the abdomen; pectoralis, of the chest; and brachii, of the arm; femoris, of the thigh; oris, of the mouth; and oculi, of the eye. Action: extensor, flexor, abductor, adductor; levator, depressor, supinator, pronator, constrictor, and dilator. Cardiac muscles. Cardiac muscles are a specialized type of muscles found only in the walls of the heart. It forms the thick middle layer of the wall of the heart known as the myocardium. Its structure is branched, striated, and has a single central nucleus. These muscles possess autonomic function with self-stimulating properties, enabling heart to pump blood throughout the body continuously till death. Factors influencing movement. Complexity of form. How complicated or simple a movement is can be determined by the complexity of form. Some movements are simple, like walking, while others are more complex, like sporting activity. Page number 41. Joint complexity. Some joints allow simple movement, like the hinge motion of the elbow, while others allow more complex movement, like the ball and socket joint in the shoulder or hip. Figure 5.17 has been given here. In this illustration, different joints have been drawn showing simple movement and complex movement. We have often seen that lifting an object from the ground or table with an improper body mechanics or movement results in lower back pain. Figure 5.18 helps us understand the dynamics of force application and its translation. Figure 5.18 has been given here. In this picture, drawing of a boy has been given who is lifting an object which is in the shape of a box. In this drawing, the spinal cord of the boy has also been drawn. Degrees of freedom. The various directions or ways a joint can move are called the degrees of freedom of that joint. A shoulder joint has more degrees of freedom than an elbow joint. Types of joint movement. The different ways in which our joints allow motion are: Translation: straight line movement. For example, sliding your hand across a table. Flexion: bending a joint. For example, bending your elbow when two joint angles are reduced. Abduction and adduction: moving a body part away from the midline, abduction, and towards it, adduction. Axial rotation: rotating around an axis. For example, turning your head from side to side. Circumduction: moving in a circular motion. For example, circling your arm. Page number 42. Force and range of contraction. Muscles can generate more force, that is, strength, and allow more range of motion. Force, strength, and power. Force is the push or pull that muscles create. Strength is how much force a muscle can produce to overcome resistance. Power is strength combined with speed, like sprinting or jumping, and may also be known as explosive strength. Action of muscles. Muscles work in pairs and groups to create movement. They can act in different ways. Isometric: the muscle contracts but does not change length, like holding a plank or pushing against a wall. Isotonic: the muscle changes length while overcoming a resistance, like lifting weights or throwing an object. Concentric: the muscle shortens. For example, while bending the elbow, the biceps shortens. Eccentric: the muscle lengthens under control. For example, while straightening the elbow, biceps lengthen. Isokinetic: the muscle changes length at a constant speed, usually with special equipment like an isokinetic dynamometer. We have practiced kicking the ball from grades 3 to 8, and we also try to develop expertise in sending the grounded or lofted ball to desired places, as shown in figure 5.19. The key principle of success in this skill is the force applied by the muscles and the angle of the kick. When a soccer ball is kicked, it moves through the air. The displacement, d, is how far the ball is from where it started. Displacement has two parts. X equals how far the ball moves forward or horizontal. Y equals how high the ball goes, that is, vertical. Page number 43. The ball is kicked with an initial velocity v at an angle theta to the ground. The ball moves forward and upward at the same time, and together these movements determine its path through the air. Figure 5.19 has been given here, which draws the path of the ball through the air. It shows a boy kicking the ball in the air. It has an x-axis, a y-axis. It shows the d, that is the displacement of the ball after the boy has kicked the ball, and it shows the y, that is the initial velocity at an angle theta to the ground. Exercises. 1. In the preparatory and middle stages, you practiced different physical activities, including warm-up and cool-down exercises. List 5 activities that help improve the mobility and function of specific joints. 2. Perform heel raises in both a standing position and a mid-squat position. Try to feel the difference in tension in your calf muscles and identify the muscles involved. 3. Observe the movements while kicking and throwing a ball. Identify and list the joints and muscles that contribute to each movement. Chapter 5. Understanding our body ends here.
Khel Praveen, you were just listening to this audiobook, Textbook of Physical Education and Well-Being for Grade 9. Narrator Vaibhav J. Srivastav. Sound recordist Muhammad Faizan. Assistance in production Soumya Malik. Directed and produced by Vimlesh Chaudhary. This audiobook is brought to you by CIET NCERT, New Delhi, India.